Hi everyone. So one of our panelists is still struggling to join in. I think there are some technical difficulties in the back end. I will have to check with our technical team after this. Hi everyone. So one of our panelists. The echo you got was from the YouTube live, so I paused it. Meanwhile the panelists join in, we would like to start the session. We have a plan for the day. It is I would like to welcome each one of you for the very important session we have planned in the COVID-19 Academy. It is a joint collaboration of WHO, UNICEF, World Food Programme and HCL Foundation. Today we have been planned for a state-specific session for the state of Manipur, titled Community-Based Initiatives for the COVID-19 Response. So as you all know, the community engagement has been as critical in many health initiatives globally and was even considered a fundamental component for past outbreaks such as Ebola. And also community-based responses have been very important in management of COVID-19 in India. Communities are the first responders to disaster and emergencies, and leveraging the strength of communities can help mitigate the impact of disasters. We also see that many community-based initiatives have been undertaken by different stakeholders for the COVID-19 response. So through this session, we aim to highlight the role of community-based initiative, the community volunteers, the community groups in mitigating the catastrophic impacts of the COVID-19 academy. Today, we have been joined by an esteemed set of panel, starting with Mr. A.K. Ranjit Kumar Singh, who is the documentation research officer DRO in the Department of Relief and Disaster Management, Government of Manipur. So, Mr. Ranjit Kumar has a vast experience of 12 years in the relief and disaster management, Government of Manipur as a DRO, and also as a unit officer, executive officer for different projects and administrations, etc. in various departments. He also has 8 years of experience in the research area, which is the disaster impact, and also in the flora and fauna development of database of bioresources in Manipur under the Department of Biotechnology, Ministry of Science and Technology. We were waiting for Ranjit sir to join in. Let me see. So he has not joined yet, I believe. So anyways, I would like to just welcome in his absence also, I would like to welcome our Honorable Ranjit sir for this very important session. Next up, we have been joined by a very young, talented youngster from the state of Manipur, who is Mr. Dennis Lalinzuol. If I'm pronouncing it wrong, please correct me. So Mr. Dennis, he's heading the operations department in the Highland Impact organization. Dennis is an indigenous youth activist and a human rights defender from Northeast India. He leads Highland Impact as its operation head and also works with Television for Environment as its youth engagement head. Dennis is involved with organization and policy platforms such as Difficult Dialogues, Rural Women Upliftment Society, Human Rights Alert at different capacities, and a former youth advocate at Major Group for Children and Youth. United Nations. Dennis' interest lies in social development, policy and research, and holds a master's degree in sociology from Delhi School of Economics, Delhi University. I would wholeheartedly like to welcome Mr. Dennis for this very important session. We are also glad to have our moderator for the day. So we have been joined by Ms. K. Shangnaida Tong Tong, Secretary of the WSDC. She is a social activist cum development worker with more than 20 years of experience in the development sector. She is currently the chief functionary of WSDC, and a team works on natural resource management, promoting food and livelihood program. She is also indulged in the projects dealing with grooming women leaders, women in governance, women into decision-making bodies, issues under women and children, networking and alliance building with relevant stakeholders and agencies for collective responses on the issues faced by the marginalized community. She also works for the strengthening CBOs and CSOs for asserting the social security schemes and provisions, particularly for the marginalized community, and the mainstreaming LCP DNH in the programming and policies. I would like to welcome ma'am also for this session. So with this, we are up for the day, and I would like to hand it over to our moderator. And meanwhile, our next speaker joins in. I would like to request ma'am to take it up with Dennis, sir. Thank you, ma'am. Over to you.
Thank you, Abraham, and Spare India for providing this opportunity for the state of Manipur. So for today's consultation, we will speak in two dialects, that is either in English or Manipuri. So since most of the participants for effective understanding, we will use Manipuri as a main dialect of today's conversation. So just to begin, I will the topic which we are going to discuss today. Ngasi ay khona discuss tawgadauriba topic si ay na pathok jage akoi jam singai sangla triko sarse ya aduna since market technical problem now we will request Dennis to start first. Is it okay, Dennis?
Yeah.
Yaniko?
Yeah.
Yes. Yeah, Dennis can use both English and Manipuri as well. Aduna, topic C, community-based initiative for COVID-19 response in Manipur. For COVID-19, si response tauna naba ekhoi community local gi organization sing mathau sing haiba tare ko ai su Manipuri dingang ning la su thodong nadi haite, but participants in the request matung inna we will be using Manipuri ko adu asoiba laida su nakpigini. So we have some area of concern, some questionnaires. Before we begin, I want to how to see the speaker sings the point sings not the hunting ba. Madam, the COVID situation si lakpa matamda, it doesn't not affect only COVID ki disease kak effect over the. It affects multi-layers that could affect the psychology, mental health, physical, then social, economic, at different walks of life. Mi tungan bada tungan su effect away. Supply chain the multi-layers the impact since community initiative the address main concern. Aduna Manipur state, then state atopada address the chana dabayai aduna the appropriate oiba karam haina laukat sera haibsi ahan bada thamjuninge aduna. I have 8 questions, so Dennis kon the thamjuning ba questions is ahan basida. Can traditional ways and skills that the community used in the past to deal with emergency be a valuable addition in dealing with an emergency situation like COVID? Asigi hanagi ekhoi knowledge skill thainagi ekhoi chatna bisina duga ekhoina hauna sa ekhoi da laiba traditional skill and knowledge si gi mateng sina su hauji COVID si address tawba matam sidam ekhoi damak hen value laibra natraga darkar oidra bra haiba amase. Then second question thamjoning bisina, neighbors are connecting and looking out for each other more than usual. Informal support groups in local areas have organized to support people in need. So how has human relationship play vital role in mitigating this pandemic? Dennis na si area su reach tawhani maramdi aikoina thai ni channel se ko neighborhood si the concern tawba moi ga connection si leiba adu bu handaki pandemic si the aiko social distance ko asi si da krom hai na aiko gi relationship asi su mang handabi da hojik covid si na chang handaba duna mamu isolate taurakpa matamsida the social trauma mayam se ekhoi thenne adu airagadi how do we address assising se ekhoi thokhan dabi da kram haina ekhoi gi hanagi human relationships issue maintain tauna kram haina ekhoi gi community na masigi damak so ekhoi gi idea da lairaga how do we address it haiba masina second point then
Ma'am, sorry to interrupt. Would be good if you can go one after the other.
Yeah. Aduna di question marisi Dennis nangonda laire aduna ahanbagi question sida hanna kara share da batare. Thank you. Now Dennis ngona matam sitire.
Oh yeah. First of all, hi everyone. Thank you so much, Sphere India, for this wonderful opportunity. There might be a little bit of interference because right now it's raining hardly here in Chorachandpur, so you might be having some sounds of rain. And also, yeah, thanks to all the Sphere India team and to my co-panelists to share this wonderful journey and the experiences from the ground, especially here from Chorachandpur, and my engagement with Highland Impact as operating currently on how we fight COVID here, even in the district. So I have many stories, really interesting. It has been an amazing, like for the past 1 month, being at the forefront and working. But also, I'm not really good in Meitei Lon, so sometimes I will be mixing it. But anyway, tanggacheri nang koy loy digi damak na kasi as a panel sida, like what I really want to discuss about as AJ Sayangnidar is talking about, asking me was on the traditional, like, but first of all, I would like to first address, who are we? First of all, we are a community, and that is something that we must be really, really concentrating on in these difficult times, because as a community, it's really important that our response, our support comes from the community. So there is this very ethical system for us, what we call Tlomngaina. Tlomngaima basically means that altruism or volunteerism for for the society, the selfless effort. So I think in this time of COVID, rather than like exploring so much of right now with all the other medicines, but we need to really look at our core values as a human, as a as a community, because this spirit of volunteerism, this spirit of togetherness is some of the main key that is really important, which for the past month have been, like, for me, for my case, like for my work area here in Chorachandpur, that's what I feel like. Community has been one of the forefront, and that forefront we must not forget. I'm not saying that doctors or administration are not working, but without the cooperation of the community, nothing in this fight would be possible. And secondly, what is really important is that we are fighting a virus, which we all know, but major chunk of it, we are fighting psychology, the psychology of psychology and social stigma, which we are greatly fighting. I've been to the field, since the past, 1 week, to the remotest place here in Chorachandpur towards the Mizoram, Manipur border. And what I really find is that rather than the virus, what scares us is the social stigma. The social stigma is a problem, much, much more problematic, especially in rural places. Even not just in rural places, like in a town like Chorachandpur, we are having a big issue with social stigma. And I think in this time, what is really important is community, where community comes together, a joint effort of community that, this is okay. This is something, this is a virus. We can defeat it. We can do it together. That sense of community needs to emanate. And for that, we need to invoke our traditional ways of, engaging the community. What is the traditional way of engaging the community? First of all, is like you call, like, for example, now we all have a village task force, Kungi task force. We also have, a district level monitoring. Now we have assembly level monitoring in the in government, in the state. But what's really important is, without this participation of the community, without the participation of the village authorities, without the participation of the municipal bodies, which are at the, which are at the rural or at the ground surface, nothing is going to work. Because either it's traditional, any kind of, what we have done, it's not going to make use. Because what I've seen, like personally, is the social stigma, the psychological trauma that we are facing because of COVID-19 is huge. And the impact is something which I think it's like everybody is facing. And right now, why the second wave take lots of life on young people? Now, because first wave, it hits the old people, we are saying. But now the young people are depressed. I think we don't die from the virus right now. Many of us are dying from depression. Depression, to be away from family, to be away, to be look like something like we are aliens, that for 10 days, for 15 days, that's worse. And I think that trauma, that social stigma is something we need to fight, not just the virus. And we are concentrating too much on the virus that we forget to concentrate on these matters. And that is why for us also at Highland Impact, with my group of team, we have been like making calls for home isolation. We have been monitoring every day for more than 500 people for the district. And our, paramedics staffs helping the CMO's office, we have been making calls, 200 calls a day, at least, to, ask them, like, what is happening besides their health? Do they feel alone? Do they feel isolated? Do they feel that nobody is like supporting socio-psychologically? And that's something that we should be stressing a lot. I'll just like to quote Dr. Thanglangal Moan when I went to 110 kilometers away on Sunday to Songtal, that is towards the Mizoram Manipur border. And what was happening there on the ground is that, the problem is that we are not facing a problem with the virus. We are facing the problem with people, the people having not just social stigma. They are seeing the virus as something which is, which is like separating us. And it hurt us. And that's one of the main issues. And that's why at this juncture, it's really important that our village authorities, our COVID task force at the Kun level, at the village level, and organizations, the community-based organizations and NGOs are very crucial at this point of time. And we are crucial because we are filling the gaps of the government, of the authorities. And it is not time for bickering. It's not time for, talking about, the state has not done this, the state. It is time we put in our efforts together. That has always been the spirit of, our traditional, you fight, you go for hunting, you go together, you don't go alone. You chant war victory not alone, you chant it together. That has always been our forefathers. And that is why at this time, our community needs to be invoked. That's what I feel that first of all that we should be looking at. And secondly, I would just like to share a little bit on what we have done, the way, the situation of what is happening in the ground. I would just like to give you a few updates from the rural side of Chorochanpur. Few days ago, there was an issue. In what we call Tuiring Paisen, after like a case erupts, and on the first day itself 33 people were positive, and the next day we test again and there were 9 positive. It was a village which is like 30 to 40 kilometers away, taking the arduous journey. I was there with the team, and one of the main critical problem with it was that people were seeing not the virus. People were seeing that these people are unwanted, so they from the village they moved them out. And what they were feeling was that these people were feeling that they are being unwanted, and it's sad. I was there on the ground. We convinced, so we convinced with the CMO surveillance team, with our Highland team, and what we did is we need to do counseling there on the spot, number one. Number two, not just counseling, but we need to aware them we need to aware at two levels. One is that the virus is not something that walks, because what they feel is that the virus, the moment you see even the person, the virus comes to you. That's what, people in villages are thinking. And the next thing is that they think that, once someone has a virus, you need to keep them far away outside of the village. That's what they're thinking. And that is why these are the critical interventions that even the state and our NGOs and our community-based organizations need to really intervene on, because sometimes government's mechanism are not enough, and we must fill there. And we must have a joint collaborative effort. That has always been, the way which I am trying, I'm asking people, because like only then we are going to defeat, either it's a second wave, third wave, fourth wave, let it be the 10th wave. But if we are not taking this, it's not gonna happen. That is what with the, the traditional mechanisms, which I would just like to share. And why community? I would just like to add one more point. For the past 25 days, we have been giving more than 1,000 meals to frontline workers in the isolation ward, COVID care centers. And what does that show? Like, people were telling that this is a community. And people we instill, which we call it our decentralized kitchen. So in our decentralized kitchen, what we do is mina, cha, yensang, anything, they cook it in their own comforts. Like, for example, I cook a chicken dish, I cook eronba, I cook uti, someone cook a rice. We all collect it together and we give meals every day, 2 times a day. And that is what we show, that community is there. And people feel they are not left alone. If we leave people behind in our response and our support and our failure, it's not just an institutional failure, it's a human failure. It's an ethical failure, which I would say. And that's why we need that joint collaborative effort. And I would reiterate once again and always that we must come together. It's no time to find fault always. It's time, if we find fault, are we someone that can fill that up? That is what I would like to share with the first set of question. So I'm not sure whether who can understand everyone, because I've been like into the mood and I'm just telling everything in English. So I don't know. Yeah.
Thank you, Dennis. You have mentioned most of the questions which I'm going to ask, but I would like to also add some more queries, like to little bit deeper on the point. You also mentioned a little bit on the relationship which we, social stigma is one of the very important impact COVID sida phangba ko the impact of COVID. So your team is addressing on this issue that is really very important, vital role you have been playing. So I also would like to ask you about how your the neighbors are connecting and looking out for each other more than usual. Of course, you have mentioned a little bit on that. Informal support groups in local areas have organized, which you have also mentioned, how you have organized, but the need, on the need part, and how has human relationship played a vital role in mitigating the pandemic? You have mentioned that one. So this, and the third question I would like to put is community volunteers, which you have organized this Highland pandemic group. No? Yeah. So here, in times of emergency, not only on social, addressing the social stigma, but also in emergency, like naba laire ko hairagane, how do you play? Aduga moi gidamakta kari role laubra. Then also volunteers singi dabakta, do they need training? Training si darkar oibra for your volunteer groups. Then later also noigi local giduna opera, but we also would like to know whether this village task force group or these community volunteers need capacity building or any type of training required.
You've mentioned about human relations, which I would like to also focus a little bit once again. In this time of human relationship, we need kindness. of all the other things. We need kindness. Kindness matters so much at this time. You pick someone called you, they are in distress, you cannot just say, I'm not sure like whether that exists or not. You should be part of the solution. And that's part of kindness. Kindness could be really different in any ways. First of all, it could be in terms of donation or helping someone. Sometimes it could be, in your support mechanism, or just, someone called you and, you kind of respond in such a way that, they feel at ease. Or in times it could be, you invoke someone, your kindness, like at least also come and help us. That's the way which I am seeing. But in this very, very crucial times, as I've mentioned, kindness should be the key in our intervention. I would like to share, a story of our response. So we receive a call at 11:30. The hospital in, the district hospital in CCP were saying, we cannot give you an ambulance because this ambulance say COVID gidamak ne. And they called us because we launch our helpline. So we intervene in two ways of our helpline. One is in teleconsultation, doctors, because we have 7 doctors currently involved with our team. And we have 5 nurses, like medical nurses who can help out. And we have 2 ambulance. We make it a makeshift ambulance which can respond in time. So the district hospital were saying we can't carry because it's only for COVID and this person is non-COVID with other complications. And what do we do? Because now the hospital were saying we can't help you. And that's where we say, we can help you. Come on, like, come, tell us, like, what's your problem? And Moina, like, we need to go to Infal because we need to go to RIMS and we need to help, we need to get that medical attention because this medical attention is not available in the district level. So we have been referred to Infal. So, our drivers, like we're at that 1 a.m. going down to Infal, they came back around 6 a.m. in the morning. So this is no time for, like, I'm sleepy, I am having other engagement. It's time for a quick response. And quick response can save life. And for quick response, we must be kind enough. We must have grace. And that human intervention is something, true kindness is something of a very, very important key, which I found out in the past, 1 month. And through our ambulances, we have been faring COVID, non-COVID. And as you've talked about relationship, there are community home isolation centers, now started being established. And people even have issues with even basic access to go to even to the CHIC because they don't have a vehicle, especially people from weaker sections of the society. They don't even have a vehicle to go either for testing, either for going to community home isolation, or either to even go to a basic hospital. So that's where we come in. That's where we try to, work as much as possible because it's really important that we give that quick response. And, private ambulances charges within, just within a small village, kungi damakta su chamangane. So 500, what can 500 buy? 500 can buy your ivermectin, your vitamin C, your vitamin D, your zinc tablets, and many other stuffs. 500 is a lot of money for a lot of people. And how we need to, look into this. We need to be kind. That's where I would like not just the CBOs, even the church or even religious organizations, especially in Manipur, needs to kind of like lend their support. It's been like, I'm not saying that church or religious organizations are not lending their support. Some does not, but we need to come. This human relationship needs to change, and this is one of the big learning that I personally, along with my team, has learned. And since we talk about volunteerism, that's what I like to enter on, like how volunteerism has changed. As an indigenous tribal, we always have that spirit of volunteerism, but the spirit of volunteerism has changed over the past times. And in terms of COVID, it has been more challenging. You see someone in a PPE kit, it's scary because like you think it's something of an alien thing happening, someone dying, people are seen in PPE kits, and it's scary. The sight is scary because it impacts us psychologically. And that's where the spirit of volunteerism needs to be looked in a different way. It must be looked in a way where we must train them. Like that's where training comes in. Training not for an expertise over soft skills, training of the mind. Training of the mind is something which I've been like focusing a lot through our group, because until unless we train our minds, because for example, people are having issues. um, when I went to Turing Tyson and to Songtal, I've interacted with more than 450 positive. Like, I hand them the medicines. And when you do that, people see I don't wear a PPE kit. I just wear my face mask, my N95. We wear gloves, we wear face shields, in case. And at one instance, I don't even wear a face shield or a glove. But nothing happened to me. Nothing happened to me, because we should tell them that it's just by interacting or giving medicine or handling something, you are not gonna be COVID. You are not gonna contract it, because now people think that just looking at them from afar also, they think that they might get COVID. And there has been this misconception. There has been very It's not people are aware. People, we are so aware, but we are stubborn. That's what I am facing, like, in the ground. People are stubborn that they don't want to be accepted. They don't want to accept that they are COVID. Just day before yesterday, one of my nurses came to me and was telling me, Dennis, like, this there is this diabetic person, and he has been telling me he is not positive, COVID positive. And I say, tell them that they are COVID positive. Tell them that if we don't give them attention right now, the last giving response in the last is not going to help them. They are going to die. You need to tell them the truth, because we believe in fake news. We believe that getting vaccine will make us zombies or chimpanzees. That's nonsense. These are happening in WhatsApp. It's not that we are aware. Our awareness is wrong. Our awareness, the place where we are aware is wrong. And that's where we must come together. That's where we need to fight. We are fighting an infodemic. Right now in Chorichandpur, I'm fighting an infodemic with many of the patients through my nurses, through going to villages, because people get the wrong information, and getting the wrong information lead us to a beyond a pandemic. It's an infodemic. This infodemic is something which is rampant, especially in rural places and even among educated people. Forget about the elite. Some elites also still believe in it. And that is something that we must really, really address. And this could be addressed only at the, through community intervention. People also stop believing in doctors. I don't know, like that's where we have been scolding even villages, and we try to aware. And one key, vaccine is the key. We must keep on making that awareness. Either people wants to take vaccine or not is another thing, but that awareness needs to be there. And even villagers don't believe in pictures anymore. That's what I've been told yesterday with my conversation with all the home isolation doctors in Chorichandpur. And they're saying, we need to take a patient who is COVID positive, or we need to take a patient who is vaccinated and nothing has happened to this person. He has this complication, this comorbidities. That is what is happening. And that is that main issue. So volunteerism here right now, they need a training of a different approach. It's beyond soft skills that we are a lab technician. You get a nurses also. A doctor cannot, like yesterday, there is this person we bring from Songtal, which is 120 kilometers away from the town. And what happened with this person, which needs to be put at the COVID care center because he has an asthma and his SPO2 level is very bad. And on the middle of the road, he get out of our ambulance, he lies on the road, he say he don't want to come anymore. And what should we do? In that time, we call the doctors, and the doctors say, by hook or crook, you need to bring this patient to COVID care center. We can't help him with anything. So at this time, it is not soft skill that's gonna, not gonna convince the patient. This is where, humanism needs to come. This is where, our approach needs to be different, because just because you're a doctor, you can't convince a patient. And we must know that. So we here at Highland Impact Team, what we does is that we train our nurses, our volunteers, our delivery people, because we have connected with more than 200 ashas delivering medicines to the last mile. And what we have done is that, we need to have that convincing skill. We need to have that kind of skill, which is really important. Either you have a medical degree, a non-medical degree doesn't help these days. because either you are trained or not. So that is what is happening, and we must train our volunteers towards this human angle. That is where volunteerism comes. And that's why, like right now we have more than 50 volunteers, people in the community kitchen, a decentralized community kitchen, people going and delivering medicine kits who are positive every day. We try to give medicines before 24 hours so that they can get their ivermectin, their zinc, their vitamin D3, 6000K, their vitamin C. We try to do this, coordinating with Ashas to the last mile, even if it leads us to, like, because Chorochandpur area is like, it's very huge. And what we try to do is that, like, even if it's 40 kilometers away, my delivery volunteers go and drive. It's not a matter of it's 60 kilometers away. It's delivering and responding to the last mile and bringing that trust to the people will create the difference. And that is where kindness comes in. It's not about, many nurses are not, there has been a notice that of about, to intake of doctors for COVID care. People don't want to volunteer. Here, people volunteer with us because it is about the humanism that we try to bring in. And that should be our approach. And that is the key right now in fighting. Either it's vaccination, you want to convince people, either you want to convince people that COVID is real, that COVID is something that can, kill them at one point of time, because if they don't address this on time, either even if they don't get their remdesivir on time, this is something that we need to explain in such a way that they need to convince them. They need to learn that, and it has been a trial and error. Our volunteers are nurses, paramedics, our lab technicians, are people like me without no medical background, just with development, coming from a development or sociology background. But what we have learned in the past 1 month is that it is, your degrees and your degrees doesn't matter. Your skill of convincing, interacting with people, making them realize that kindness and all these things matter so much at this time is one of the key. So that is what we have been trying to do. And we have been partnering with the CMO, Sunbart Trust, and many other individual donors helping us. And what we learn is that it's an ecosystem we need to build. Not just with with the NGOs themselves. The NGOs can be powerful enough with all the networks, but we need, at the end of the day, we need to work together with government. We need to work together with CBOs. We need to work together with individual with skills, without skills, and that's where everybody fits in. So that we are in a race to leave no one behind in this COVID fight, and that's the only way. So because in Manipur, the rural places are facing the brunt right now. In Chorochandpur town, it is normal now. Like, having COVID, this Kun or this Laikai having cases. But now it is 110 kilometers away, 150 kilometers away, which are facing, like, recently, just yesterday in Singat, more than 20 were positive and they were panicking. And so today we went, my team just came back with delivering medicines, and they were saying, that delivering medicine and, telling us that we are here makes a difference. And that is the kind of experiences that we have at Che. So that's what I would like to share. Like kindness, I would like to focus on that's with all this volunteerism. Yeah.
Thank you, Dennis, for your comprehensive and also very effective approach in Churchandpur, which really helped the people in the district. So the last point which I want you to mention is your important role, the role played by your team members. How can it be strengthened at the national level and also in the international level, so that this can be adopted at different, like in the larger platform? So that if you can also mention that one. And besides that, how's Dennis the high kiba mayam say actually participants in say I would like to know ngasi Dennis na share daw say kaya ayamba understand tawdaba Maitai-lon da khitang brief tawo haibe yaubra haibsi chat box da noina khra haibiba. Then also question hanging ba hojiki Highland impact na lawriba role se clear oi hodaba khangning ba leiraga su chat box da habraga hoiren ekoi discussion matam sida uthokna ba chat box da dum iraga thambiyo aduga loinana ngasigi ekoi participants sing ekoi partner mayam su yauri spare india gi then civil society organization dagi different district dagi yaum sing na su nakoi gi district lom dagi chanaba relevant leiba then also Dennis kon dagi su apply to we aba sing su not to we raga comment so happy na so ai hangan jabani. So the last point is how do you take forward the infrastructure, the resource you have, your team have at national and also in the international level. As is Spare India, asigi line the su, Madam this Spare India being an interagency group, international connectivity level na masising the su, her mention tawin ba request. There is.
Thank you so much, Jay Sangneder. Like in terms of that intervention within, like how can that be replicated to a government, the state or national or international or with agency? You know, like government is placed much as a better level because they have the infrastructure, they have the resources, they have and the talent pool because they have, you know, they have that talent pool. But what is lacking with government is about communications. That's one of the key. You know, like why NGOs are also effective at this point of time is that government must realize that NGOs are effective at this point of time is because of communications. So communications could be at different level. So one of the communication is communication with the community. So how the government is being seen as, like, you know, there is a story in Bihar, if you read in the print yesterday, is that if you come for vaccination, there is this women, the Adivasis, like who are there. We're saying, if you want to vaccinate us, do it like an election campaign, give us the money. So that is what is happening because the government, you know, the way from, because there has been rampant corruption, there has been a trust issue. So government needs to build trust the way how a community-based organization build trust with the people, and that's the key. And that key can only be facilitated with communications, and there is no other way. That's the entry level because or else it will not sustain whatever measures either you do your health or either you do your vaccination or any other, you know, great initiative it could be, but it will not sustain because your communication key is not clear, because the way how we communicate, the way how we intervene, and that's why, like in our learning, government must see NGOs and CBOs as their partners, because they must also, you know, like they must also work on together with us. That is where that's what exactly we try to do with, at least with the office of the chief medical officer in Chorochanpur. We say, see, this is what we can do, this is how we can help you, this is the gap we have identified. For example, the gap that was happening was that CMO office with they could not give the last mile delivery of medicine. So that's where we intervened using delivery mechanisms. We contacted the ASHAs with the ASHA facilitators, and that's where we come in. And that's why it, as I say, it needs to be partnership. As the UN Sustainable Development Goals talks about in the 5 Ps, out of the 5 Ps, 3 things which I always feel very important is planet, people, and partnership. So planet and people, if you want to cater to that, this if partnership doesn't happen, if the government is working in silo, if the government is working on a different method, the NGOs working in silo or different NGOs, if we are not coming as a platform, if we are not coming as a collaborative effort, it's not gonna help. Because right now we are, as I say, besides the infodemic, we are fighting name making. The government is also trying to make a name. Many of the CBOs are also trying to make a name. In spite of that, let's forget about that. You'll get your due recognition if you do your work properly. Okay, either it's the government or a CBO or an NGO, but let's focus on the work. Let's not try to think like, if I get this name, it's not for these and that. Let's not fight for recognition. It is the impact that we make. That impact, as I've been telling, you cannot change the world until and unless you even change, people around you. And that is what exactly what is happening with us. We need to change the world around us. And for that, we need to build trust. Government needs to build trust to people in different mechanism. Ration, only mass vaccination, mass testing will not work. Not always, because right now this just the key to entry. But what is happening is like the way how we respond, making people feel important that they are working, that government is working for them. That is one of the key, and we must focus on that. And that's where exactly, in Churachandpur, at least we are working on it. And I am not sure of other places in Manipur itself, but in Churachandpur, at least we try to respond in the last mile delivery. We try to respond and work together as much as possible. Even in mass testing, we followed. NGOs are part of it. CBs are part of it. Village task force are part of it. And only in that way. So this model is something which is really important, not in silos, but we must, join together that forces. And this is what we have learned. And that's where, we give volunteers to each other. And because like even to government has the infrastructure and human resource, we can make that system robust together. So that is where I would like to, not just, just say in the government that system much change, but it is like a collaborative, a partnership. I would say that's where I would just like to stress on this question. Thank you so much, Che Sang Naida, for that question.
Ma'am, you are on mute. So
yeah, we have one question for you.
Yes, ma'am, before that, no, though it is late, but we have still our speaker has finally, he was facing a lot of technical difficulties, but he was still struggling and have finally joined us, Mr. Akolam Ranjit Kumar Singh, the documentation cum research officer DRO from the Department of Relief and Disaster Management, Government of Manipur. So he has joined us, and I would like to welcome sir and request ma'am to kindly put across the questions to sir too.
Yeah.
And we can have the question and answer just in case any of our participants want to share any questions. We will be having the Q&A round, open discussion immediately after Ranjit sir's sharing. And you can either raise your hands here in the Zoom meeting or else share across your questions in the chat box.
Yeah.
Over to you.
So thank you, Abraham, and we would like to welcome Sir Akolam Ranjit Kumar Singh. He is the Documentation cum Research Officer, DRO, Department of Relief and Disaster Management, Government of Manipur. We are privileged to have you, sir, in our as a panelist. So we would like sarngon da matam CP aduga from the participants request ke matungina if possible may they learn haibi rade hen na community gi damak effective oigini have say participants in demand matungina aduna English ka may they learn the mix tawbi na basu haijare aduna Haudokpada Sarwana Thamjiling question. Ahan Basidi, what are the guidelines to get community involvement in a time of emergency like COVID pandemic? Asi the community guidelines kari labra haibam si ahan bada thamjiling. And I have some few more questions ahead. So this will be the first opening. Thank you, sir. Time is for you.
Thank you, madam. Madam, am I audible?
Yes.
Okay, madam. Thank
audible?
you. Yes, I am audible, madam. At the beginning, I have some problem of connections, and very sorry for that. And at home also, I have some problem with COVID-19 patients around, and they have some serious problem. I help them after then and try to join somehow. It is okay now. Regarding that question, madam, as far as the government has some broad guidelines, not minute one, it is something like community help or community extension of help to COVID-19 is not that much easy as other disasters because it is very contagious virus. We all know that, and uh, if the organization have PPE, personal protective equipment, that is apron and a mask and some uh, isolation type of uh, any equipment for headgears is required, as well as there should be some distance, and after that this PP is a single use type of dress and it should be disposed of like this. We are taking help from the community in many ways, and the more accurate this guideline is developed by health department, and the implementation is done along with home department and the health department. As of now, we are doing the release of some funds to run the district administration as far as COVID-19 is concerned. In this regard, I don't have a deep knowledge about this. Sorry, madam.
Yeah, I saw some like we have SOPs like standard operational procedure. We have to government side to develop. We saw many orders passed by the government of Manipur under the health department. So, see how far these orders are being aware by the community. Asi amasu Madam, the order Kiamuk passed Tauragasu, SOP Kiamuk si developed Tauragasu, whether it really reaches the community, knowledge well informed or Ibra Haiba Mesisu, Karam Hain monitor from the disaster management side or from this COVID redressal group na sukram hain tabra haib sing koren san na sukitang banbi na ba. Then second question si da ekoi na kitang muka sanwana high handing si how crucial is capacity building of community for effective and timely response to a disaster in the context of COVID-19 pandemic and the restrictions posed by it. How can this be achieved? Suppose there are many orders, SOP miyam su laire, order miyam su laire, aina ahanbada thamjakibasingse aduna community sina follow tawnaba capacity building moi si leibra duga kiamuk lubra mi singsi follow tawnaba hotnaba tamda lubra then luraga di karamba mechanism si sijanaraga SOP follow tawhanbra order follow tawhanbra si asi amasu mention tawaninge sa.
Thank you, madam. Let me submit my reply. This is not an easy management. Everybody knows. That is why government is also making in such a way that in a common form of guideline, aduna ngasai mayamna follow tawbasi heta my necessities and negligence aduna maram moraga heta kitang kai nabachi oibako aduna. As far as SOPs are concerned, it is a question of life and death ana khoi mind setting ji kidang humbiraga yam serious oiragadi masi khoi mai pa pangamgani na thajai aduga ngasai difficulties like tabdinate in case of corridors moving together in a car khoi distance ka ji adu kitang comfortable oide adagi khoi standard of living ji kitang khoi ꯋꯥꯡꯗꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯊꯥꯛ ꯋꯥꯡꯅ ꯂꯩꯇꯕ ꯃꯐꯝꯗꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯌꯥꯅꯕ ꯁꯤꯟꯕ ꯑꯗꯒꯤ sugumba difficulties adum legani khali aduna infrastructure phajana leraba standard of living phajana leraba mi dadi mu khidang easier wegani khali aduna government gi side tagi su akhoi gi chana thangna ba dagi quarantine centers adai transportation da kaida yari makai akhoi gi district authority gi makai dagi section dana lei aduga ngasegi kaya mai pa age have si ꯑꯩꯈꯣꯏꯒꯤ ꯃꯁꯤꯒꯤ ꯃꯇꯥꯡꯗꯁꯨ ꯑꯩꯈꯣꯏꯅ ꯃꯌꯥꯝꯅ ꯎꯕꯤꯔꯝꯒꯅꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯨꯂꯤꯁ ꯐꯣꯔꯁꯅ ꯑꯗꯨꯛꯀꯤ ꯃꯇꯤꯛ ꯂꯣ ꯏꯝꯄ꯭ꯂꯤꯃꯦꯟꯇꯦꯁꯟꯁꯤ ꯇꯧꯅꯕ ꯑꯗꯩ ꯃꯈꯣꯏꯁꯨ ꯔꯤꯛꯁ ꯂꯩꯅ ꯂꯝꯕꯤꯗ ꯀꯃꯥꯏꯅ ꯆꯠꯄꯅꯣ ꯃꯔꯝ ꯂꯩꯇꯅ ꯆꯠꯀꯅꯨ ꯑꯗꯒꯤ if it is not very serious ꯃꯁꯤ SOP skip ꯇꯧꯑꯣꯅ ꯑꯗꯨꯝ ꯇꯝꯕꯤꯕꯗꯨꯅꯤ ꯑꯗꯨꯒ ꯃꯁꯤꯒꯤ ꯃꯥꯏ ꯄꯥꯛꯄꯒꯤ ꯆꯥꯡ ꯑꯁꯦ if we are serious, if our mindset is changed, ado akhoi goal ji yong ne have thajar aduna atopa country da su ngasagi sigi setting si leibadagi ni akhoi na tamna khogi khitang hujik si pandemic si khitang farena launa ribse aduna akhoi farakani thajablai aduna akhoi thajana akhoi gi government na piba SOP sing si inba adagi khitang khangba kanna akhoi life asi ya maru oibanina masi smai changjan minaga achieve tongni have si thajaba thambiraga government is akhoi representing unit kano apex body mani machine hari se akhoi phanabani khallaga changjan minabasi tai ha thamjage
Aduga sir, I have one more question for you. Community singsina like in Sumai, how can the community be an asset rather than liability to the government and other relevant stakeholders that deals with disaster emergency like COVID? The government tawrakani han depend over even akhoi district su suppose me say mapanda gi yum lak su loi na mag yum phau thong lak su moi gi mathau ne haina ko relatives sing su totally depend on government su laye then anaba mi lagaga the relatives sing accept towning da su laye aduna community level from the family community leaders in CSOs CBOs sing sin su asi su akhoi gi ithau ne haina khanna na base akhoi asigi COVID ki matang sida government gi failure ne haina khakta blame taw da bida akhoi community CBOs and POs in the civil society organization na su karam haina tawradi henna ownership se moi lawgadra haibigi matang su khara mention tawhani asa.
thank you madam let me submit my supplement again akhoi ngasagi SOP si phajana nga paloina na akhoi involvement si NGOs the CBOs mayam si akhoi at their level involvement si yamna darkar lay aduga akhoi khangjabada hanasu active boy lakpa Indian Red Cross Society mo yam phajan toromi andagi state level da mogi positive khara way habadagi mu khitang suspend tawrure mogi participation je aina paulo jabda aduna sugumba leraga diena akhoi government of Manipur na akhoi as under the guideline of government of India akhoi deputy commissioner sing da sumaina work tawba NGO adagi any representative leraga di recognize tawraga marak sida akhoi sumaina understanding obe aba adagi moida material piba de moida moral encouraging tawba do's and don'ts khara tawsen haibani adu hujipokta akhoi moigi nodal officer sing DC na hapire aduga sumai tawna NGO sing si sumai lei have si ira laktri aduga akhoi yengjabda report tawdraga su many pockets of the our community adu akhoi NGO work tawbu ujai formally moina laktraga su aduna sumaina akhoi report khakta natabda akhoi unreported mayama su they are working at their best level aduga community level da su particularly in like village adum phajana work tawing thajai aduga moina khitang akhoi marks standard labor watpa dagi phangba watpa effort tong namdaba difficulties khadam ui aduga madam aduga yam successfully managed the approach many na idi thajai aduga yam holistic all of a sudden adagi very risky approach weba COVID-19 se aduga community level gi participation je adumaina adum lay aduga sumaina koigi pandemic ama epidemic ama lakpas di hongna sani masi ai bu sokadra ai family bu sokadra ki base adum hongna sani mind adum aki ba leba tamani adubu hojiti phaniam masi tungoinaramaga koigi SOP si government piripsi nga aga involvement si phaniam tawrabran thajai aduga moigi maraktagi report tawsu yawi report tawtabsu yawi adu akoina chala yengjabda dagi koi media sing dagi pau phangjabda masi ai personal mode oina di yamna phajana involvement si yawbran khale. Thank you mina.
Thank you, sir. Hojik, now we are, I think, Abraham.
Yes, ma'am.
Yeah. Now we are running out of time, but I think there may be some few questions we need to pick up, or how?
We can probably take one common question and both our panelists can answer to it. We thought that there is one question which was posted by someone on the chat box. So you may wish to like read it out and both our panelists can take 1 or 2 minutes in responding to it. And with this, you may summarize the session and we can conclude.
Yeah, I think we don't have much question thing, but there is one person who doesn't follow Manipuri. I think she's from Churchanpur. I don't know. Dennis, I think you can help her out. Yeah, Nico.
Right.
But I don't see questions from the participants, but I have some few concerns. Not actually.
Ma'am, there was one posted on the chat box which I may wish to read it out. So it was like, can you please tell us what are the possible risks that the world face in the COVID-19 pandemic?
Yeah, this one. This is, I think, Dennis will be the right person to answer because you have your volunteer group, huh? Or even sir can also supplement.
Yes, sir, Ranjit Kumar sir can also do this. Both would request both of you to like share your views on this.
Yeah.
Okay, someone could not understand. Let me just address that. So basically, Sir Ranjit Kumar was basically talking about, response mechanism basically on, especially with PPE kits, and he's sharing all the strategies, the challenges with the strategy. And so basically, like PPE kits are costly. That is one thing which what Sir has mentioned, like it, and you need to dispose, like it's a one-time use. And I think it's really, like that's where Sir is also trying to address a lot on that even if it's government, it is not out of, it's not really out of, non-challenges. It has many loopholes into it, and they are trying their best to also look into that. And it's also, it's also about, how can, everyone is fighting it, and how can we, like look into more responding strategies. So basically that's at the core of, like, basically on stressing on the protection and stuff. So but with that specific question, I would just like to address about the vulnerable groups, the risks that they face. And I think at right now the vulnerable groups are of people who earn their daily lives. For the past 1 month, like through Highland Impact, we have arranged more than 20 oxygen concentrators. 5 BiPAPs comes through our mission oxygen and, oxygen exchange. We actually bought for 50 for Manipur, 30 were disseminated for the whole hill district, and 20 for the valleys. We put it, which was inaugurated by our Honorable Chief Minister Biren Singh. And the BiPAPs were there, but specifically we are trying to bring in specifically for Churachandpur area. 20 more BiPAPs are coming from Japan, and that is the way how we are trying to do a lot, trying to help even the government. But the vulnerable groups are more like, in spite of talking about, there is lack of oxygen, what is more important is that, I think Mary Beth is also here, which I've been associated to Rural Women Upliftment Society. She used to tell me, we can't eat oxygen at the end of the day. We need food also. I think vulnerability here could be looked at two ways. Either it's a medical, health vulnerabilities and livelihood vulnerabilities. And we need to address in these two specific ways. So one is like people, vulnerable groups like, street vendors, people who earn their daily wages, are out of their work. And so how are we going to respond to that? One medically, one economically. So that's where, government mechanism we need to push also, we need to kind of work together with government on like having the Food Security Act. We have the Food Security Act that, guarantees them rice, dal, basic necessities, like based on through the public distribution system. And medical, through like, for example, we have the Ayushman Bharat and all this kind of, facilities. So many are not aware. These vulnerable groups are not aware. So we need to be intervening in such things. So system exists, support system and mechanism exists, but many could not get that system because either they are unaware, either they don't know how the process is like to have that accessibility. So even it's available, it's accessibility, the ways to be accessible. And like we are not talking about the sense of buying on those aspects, but more on the way how we could actually help with already strengthening the already existing system. We don't need a new system, what I would say, to address vulnerable groups. We need to rather strengthen and make the existing strategies more robust. And that's what I feel like is the key. And that's the way how we should be doing. And then if a system doesn't exist, that's where we should convince in the policy infrastructure that this is not there, and the government, we could tell that this is what is not there, so we could work together for it. And that's where partnership, as I've mentioned earlier, comes very crucial, especially with COVID pandemic, because this pandemic is one of the worst pandemic that the globe has ever seen. And that's why our response could not be like the way how they have dealt with the Spanish pandemic, or with the cholera, or with the pandemic that even happens, the several pandemics that happens in India, so, or the epidemic itself. So we need to really look into the strategies that are existing. We should address through those strategies or systems for these vulnerable groups, especially in health and through rations or through economic aspect. That's the way, and that's the way forward, which I say, which I want to share.
Sir, could you please share from your end?
Ranjit Kumar, sir.
Yes, madam. I have to supplement some lines, a few lines after Sir Dennis mentioned. This is very challenging time of the government. Government consider food as a number one. According to that, government has done to some extent reasonably. And the economy support as such we are discussing here is a bigger challenge again. And when the situations calm down, government may consider for this rehabilitation part. For the time being, is just to survive, just to support medical in part one. Number two, food. I have to mention these 2 points. And for economy part, yes, this is the very negative impact of this pandemic, and government will consider, I hope so personally, when it is subsided, government will open one good chapter of rehabilitation part to some extent. Thank you, man.
Also, Che Sang Naidar, like someone just
Yes.
asked these questions, I think, which I've addressed before, but I would just like to talk about why people have hesitated for a
Yeah.
vaccination or to get tested. First of all, that's what I mentioned. It's because of the social stigma, and we need to address that. It's not the virus that is dangerous now, it's the social stigma. And we need to address that crucially. So either it's awareness, or either it's door to door awareness, or in any form of awareness. And people don't want to get vaccinated because of all this fake news, and we should address that by, if you are villagers, if you go to villages, you need to take someone who has already vaccinated. Your action plan could not be show pictures that this is COVID, this is non-COVID lungs. That will not work in a village. But what work is, take someone who has vaccinated, an old person with either what they call having allergies, diabetes, or any of that sort, and say, this guy is fine. He is not dying. He is fine and he is, having no issues at all. You need to bring proof to the village. The village will not come to you. You need to go to the village. And that's where, we need to take that proof with us to the village. And it's very important. So either it's vaccine hesitancy or testing hesitancy. We need to fight this social stigma that is more dangerous than the virus. And that's why we need to strengthen our system. We need to do a lot on advocacy. That's what I would just like to address, since this is very important. Yeah.
Thank you, Dennis. Thank you, sir. Yeah, just to wind up, we have heard many important ideas, points, and also the practical part which Dennis and their team have already taken up. So just to summarize, we know from Highland Impact that intervening on the psychosocial issue is very much important, and also respecting human relationship concerning the human. Mi singbu nungsiba asi yam maru oi haibse koina Dennis tagisu phange aduga from Dennis team it's a very impressive and very yamna afaba thabak sikri ra hairaga chak sana thonglaga su yenbi ba adu si nandagi ei ta khrawne si yamna numaye aduga su loina na oxygen phanghanangai gi damakta even your team have already reached out to the international agencies adu su yaurakadaraure haibisu dum tai aduna. Then also you have a good networking and alliance building, multi-stakeholders, which you also really approach with multi-level stakeholders like doctors in nursing, aduga village task forcing, multiple walks of life stakeholders singa punna tawminadradi ngambe haibsisu. We learn from your team, and which is really important to be noted. Aduga suloina na behavior change. I would like to a little bit on this. In the first pandemic, lakpam tamda, how do we do is think that everybody has COVID infected. COVID loina pa na khalaga di social distancing. Now hana aikoina leiramdaba concept amasi COVID sensitiveness informing behavior the su aikoi wakhan the su mi loina mak say it's not I don't prefer saying social distance but physical distance. I would like to rather name physical distance. Go. Social distance we cannot keep. We have to have emotionally as Dennis na high gunduna human relationships, the social relationships in Topia, the physical distance hamnabagi habit say we need to create. That is how our organization also feel the need of the COVID-informed community. Then when we say COVID-informed community, we also learn that preventive measure then narakpam tamsida ekhoi karam haina address tawsera haibsi ekhoi address tawrak pamatam sida we need technical experts, we need doctor, we need nurses, we need community task force group, we need administration, we need adumyam si darkar singsi ꯑꯩꯈꯣꯏ linkage building alliance building se koi darkar tai hype se koi nasu koi ngasi gi panelists ani de su koi na phangba ngame in the meantime family sing si nasu koi ngasai gi test tawon tam si even isa maksu ngasai gi social media si asi test tawo bhai phate then ai gi health condition si yabra ya da bribe ai su samom naraga dum leibne ba adu ai gi marup sing su tawtho ai su tawgni ko aduna asi test na te vaccine gi matang sida aduna vaccine si karam haina kapani kana gumada kapi ai haibdi lairiba standard niyom singse ekhoi community singsida reach out tawsu mathau tai not only written in English but also in their local language tasu ekhoi Manipur da lairiba loan pumnamak tasu ekhoi SOP si translate tawba darkar ta bra si if we can translate all this behavior then khud karam haina hangani marks kram haina upkani how do we put on and how do we dispose the mask all the behavior and also every like information awareness which we need should reach to every community, every different community, whether remote lairiba khunda lairiba miyam dasu reach out tawba darkar tagni habsi khalle aduna mobile paiba ngamba internet access tawba ngamba singna khangba khakta nataba aduba experts singna hairiba kaino singse aikhoi local volunteers singsina khunda karam haini yohan sera haibigi framework ama aduga adugi kainom sudaka tagra hypes in haininge so last but in Spare India I would like to give my appreciation from our state chapter to Spare India for providing this opportunity. I hope there are many sessions we need to take up. So for today, since the time is also running out, I will wind up the session. So I'll give the time to Abraham.
So yeah, thank you so much, ma'am, for that wonderful, effective moderation which you have done. It was indeed a pleasure for all of us to have you guys, have all the panelists today for this very important session we have planned exclusively for the state of Manipur. It wouldn't have been possible with all the contributions, sharing your expertise and knowledge you have done. I am not going with the summarization because already ma'am has very well done that. Just a few quick points that as Dennis was mentioning that this is the time where we need to, apart from our knowledge and expertise, we need to bring out the humanity outside and think from our heart more than from our brains. And also it is a time for collaboration. No one, the pandemic has we had the key learning which I would personally take up from the pandemic is that this is not the time where individuals need to work. It is a time when we need to come together as a group, as a collaborative platform to work together for the COVID response. Government or the individuals or the CSOs, NGOs, no one can work for the entire mitigation alone. We all need to come together and frame up a joint action plan and work hand in hand, understand the need of the people around us and work for the common good. So thank you so much, Dennis, and also Ranjit Kumar sir for this, for sparing out your time and for being with us all throughout this session. And for ma'am Shangna Idar, ma'am, also she's a partner of Spare India, member of Spare India. Thank you so much, ma'am, for sparing out your time and for doing this moderation very effectively. And last but not the least, this could have never been come to this result without the active participation of all the NGOs, CBOs, and the volunteers from all across the Manipur state. I would like to express my sincere gratitude and heartfelt thanks for your active participation and for such an enriching discussion. Unfortunately, we couldn't have the open discussion because of the time constraints, but we are pretty sure that we can get back to you. Whatever doubts or questions or anything you have to share with us, you can always write to us on COVID-19 Academy at spearindia.org.in, and we will be getting back to you as soon as possible. It was once again just want to, in one word, thank you so much, and looking forward to have you guys in the future too, and for better collaboration together. Thank you so much. With this, we would like to conclude the session. Thank you.